Here's the booklet. We'll go through each page. So generalisation is the term we're calling, but you might hear it said as transfer of skills or crossover of new skills. And everyday speech is what we're doing now. It's just chatting, just being able to talk without having to plan. On page 1, the copy of the handout. And we've got our headings there that we'll go over. On page 2, we're looking at how we might communicate, and I've made a few pro formas for you so that you can get straight into that. And then a different version without the little pictures, and I've put up their teacher's name. So you can choose the pro forma that sort of fits the age of the client and the context. We're going to look at the idea of that team approach and getting everyone involved and who might be responsible. So we'll just look at that again in a little bit more detail. And then an important thing to be able to cover today is sometimes people are not ready for generalisation. We'll look at that on page 8. So that's the booklet of that what we're going through today. Sometimes people will not have a positive view of speech pathology in the long term because they'll get a feeling of like it didn't really work. And that can be quite surprising because you might have the client come into the session and they're working with you and they're just doing so well and they're getting 9 out of 10, 10 out of 10, and you haven't realised that it's because it's that context, like you've helped them to feel really comfortable. There's reminders, like the pictures that you use or the phrases that you use are reminders. But then if that person, when they leave, they go back to their old sounds, that's what everyone else hears. So their teachers, their family, could be grandma, could be the neighbour. And, sometimes you'll even hear through sort of hearsay or through secondhand, oh yeah, we're not going to continue with speech therapy because it's not really working. And you can kind of be like, oh, but it is working. And actually what's happened is it's not generalizing. So part of today is I want you to think, if it's not generalizing, who do you think is responsible for that? Do you think you would take some responsibility? Do you think it's up to the client themselves, even if they're a child or if they're an adult? Or do you think it's up to other people in that person's life? Like, who's responsible? Or is it shared responsibility? Is it a team? So we're going to look at that idea today of the shared responsibility. And then also the flip side of that is kind of, then it can be the scapegoat. And, what I'm referring to there would be if you've got 6 people in the team, let's say you could have a speech pathologist, a physio, an assistant, then you might have a parent or carer or guardian, a teacher, a support worker. So you've got the idea of the team. A scapegoat mentality could sort of be that 2 of those people in the team kind of go, oh, well, the speech pathologist isn't coming enough. Or the speech pathologist and the carer could say, oh, the teacher's not doing it. And it's this idea of putting the responsibility onto someone else. And I try to turn that around and go, instead of doing that, why don't we put that effort into team communication? And that usually works best if there's someone that's kind of appointed themselves as a bit of a leader or a bit of a facilitator. And that hopefully would be a speech pathologist if the client does have a speech pathologist. Sometimes it's a parent that's, really assertive, or could be like a guardian who is coordinating the team and checking in with everyone. But as long as it's someone that's doing it. Sometimes in a preschool, the director or the room leader takes a role. But would you agree that, we're talking about relationships here, aren't we? And of course, with relationships, then you come down to personalities and different belief systems and everything. So sometimes it works really well, but sometimes it doesn't. Unfortunately, one of the scapegoats, which I think is the saddest one, if this is what happens, is when they blame the client. Well, they're just not trying hard enough, they're just being lazy. They can do it if they want to, but they just don't want to. And I think that's a real shame, because especially if they're young or if they have an intellectual disability, or actually just anyone, any of us that are trying to work on something, we possibly are doing our best and we've got competing things going on. Isn't it so much easier when everyone around you is helping and encouraging you and focusing on the positives? So today we'll talk about the strategies that we can all use as part of the team to help move that person along to where the sound generalizes. The younger the person, the quicker the generalization occurs. And actually in 2 and 3-year-olds, which is the time when most speech sounds are learnt, generalization can really just go just like that. You'll teach them a new sound, or they'll just learn a new sound generally, and they don't go back. They just use the new sound. But if they're older, the older the client, the longer they've had using the old way, the harder it might be for the habit to change. So actually, the older someone is, probably the more important the team is. And if you're assisting an adult, then it can be very hard to change a habit as an adult, but it can be done. And that's where the team response is great. Often that's the one thing that is the weak link. The program has been, like, the assessment's been done, the program's been designed, got lots of willing people doing the program in their one little context, but there isn't this idea of the team approach to support the client until all the neural pathways have kind of formed and it's become automatic. I'll just do this little activity. Could you all just fold your arms and think of this as a motor planning? So when you folded your arms, you did something you've done before. Just like if you went to say Sarah and it's easy, you've probably said the word Sarah and you know how to say s and So go back to the folding arms. Okay. Now, can you unfold your arms? And just to prove how easy it is to fold your arms, just close your eyes and just fold your arms again. Yeah, and I'm watching and I'm going, yeah, everyone's fine with that. And open your eyes and unfold your arms. So you could use this as a way to explain to someone about a speech habit. You could do this with your colleagues. Say, fold your arms, unfold your arms. Yep, you were fine at that. You've done that before. Okay, close your eyes, fold your arms. Easy, unfold your arms. Now, what I want you to do is just fold your arms one more time and leave them there, and have a look. Which hand do you have? Which elbow is sort of on the top and which elbow is lower down? And I want you to fold your arms so that it now swaps. Okay. Yeah, and now when I'm looking at you, you all have a bit of a look on your face like some of you are finding that hard. And I want you to leave it there, and I want you to tell me, is that comfortable or is that uncomfortable and distracting?
Uncomfortable.
It's uncomfortable and distracting. Yeah, okay. So leave it there. Okay. Do you actually feel like you're sitting with your arms folded, or do you feel like you're just sitting with a new kind of sensation? It's kind of new, isn't it? Yeah. So one of the reasons that children, are resistant to changing a speech sound, if we rush them, is it doesn't even feel like they're saying the word or the sound. So Sarah, when she says Dara, that feels right to her. And if we get her to copy Sarah, she can do it, but it feels awkward. And then she straight away wants to go back to Dara. And this is why parents will sometimes say they can do it, but it feels awkward. All right, uncross your arms. Oh, it's probably a relief. Right, as fast as you can, however you want, as fast as you can, fold your arms. Who went back to their normal way? Why didn't you go to the new way? And that's why Sarah goes back to Dara, okay? And Janine said, even having done it before, it feels so weird. Okay, let's do one more. Clasp your hands like this. This is for you to tell that parent or tell that colleague that goes, no, I think they're just being lazy, all right? I've got my left thumb on top. Can you see which thumb you've got on top? Move your hands apart and now put the other thumb on top. Oh, that just feels awful to me. if I said you had to sit like that for a whole meeting, would that actually distract you? Because you can sort of feel it, can't you? Yeah. So that level of discomfort is what someone feels when a speech sound is not really what's coming from their brain, and it's not their planned motor movement. And this is a good way to help someone that is wanting to rush, and just say, when we say to Sarah, can you say Sarah? And we slow her right down and she goes, Sarah. It feels like that. So the next time you say, hey, what's your name? And you want her to say Sarah, if she goes Dara, it's because she's just gone back to, oh, put it back now. Oh, that's what it feels like. So when people are still at that level of, the old way is dominant for them, they're not ready to generalize. And if we ask someone to generalize before they're ready, we're actually asking them to do something that feels uncomfortable and it doesn't even feel like they're doing it. And so no wonder we get resistance. And if they can't even copy it at all, well, then it's just negative. So that in that handout, the tips and tricks, I talk about the arm crossing one, and you could go through that with someone. The last thing is, how many times would you have to cross your arms that way? Go back to the old way. Sorry, back to the new way, the weird way. Couldn't cross your arms the weird way. How many times would you have to sit like that before that felt comfortable? 2 times, 10, 50, 100? Weeks and weeks? A long time. Yeah, you'd have to do that for a long time. So that's why we have to take our time with the speech program, because we need to give the child's brain enough time to go, this feels all right. And we're not ready to generalize until that is comfortable. Okay, yes, Liesl?
I'm just thinking sometimes you even have to do the old way to do the new way.
That's right. That's your prompting. Yeah. So all of those little prompts that I was reading out, like, remember how you said fun, say this word starting with that. So
Yeah.
it's giving so you're problem solving.
Yeah.
For fun, I go fun, I must be fork. For you, you're going, she wants me to do it that way. So hang on. No, I normally do it this way, so it must be that way. Yeah, so you're coaching yourself through. Exactly right. And that's what we want children or adults to do with their speech sounds. And they might have to relate it to something else. Yeah, until eventually they can do it independently. Yeah, excellent. I'm wondering if you find you learn the most just from listening to me chat, just this sort of talking. Do you learn the best that way and you just sort of think it over? Do you learn best by coming back and playing the recording of any of these tutorials? Do you like to get all the different resources that I've got, and make a folder and go back and read them? I wonder how you're learning best from this course. There's lots of different elements so that maybe we capture everyone's learning styles. Even if just one thing sticks with each tutorial that assists you to make a change, you don't have to listen to everything and try everything. It's, what aspect is just right for you. So I've created like a little resource for you here, which will be the supplementary item. And this is articulation programs, tips and strategies. And now rather than it is for you to use, but it's also a way of you being able to now share this with other people in the team. And you go, okay, sit down. Have you got 3 hours? I'll tell you about, the short course. But obviously that's not practical, but you might go, I'd like to tell you a bit about what I've learned. And so I've created this document so that you can actually pass this out to someone else in the team. Okay. I thought that might be helpful. So you should be able to explain the stuff in here to someone else because it's what you've been learning, but it's a document that I think can go really well for the team and you could pass it out to someone. So I've just put what a definition of articulation is. And this is what you've been learning about, the sound substitutions, the emissions, So that's on there. So can you imagine now you could pass this to someone and maybe talk through it with them, but it's just giving you a way of maybe doing a 10 or 15-minute chat with them. Then remember this activity where we talked about arm folding activity. Remember the S to D where you had to change son to done? So that's just a description of it. So you could actually sit down and do that with somebody. This is where we're talking about the team approach. And if you read through this after today, it'll be sort of summarizing the sorts of things that we've gone through today as well. And then this one here, I think is really useful to be able to go through. Have you all realized that an articulation program could take a lot longer than what you perhaps had first thought? Yeah. So part of the course and part of taking 12 weeks has enabled you to go, yeah, this isn't, 3 goes, you've got it, otherwise you're being lazy. This is actually, wow, this is quite a big process. So I've actually just put that into a list, and then you could sit down with someone and go, see, so like Yara, maybe at a school, you might be advocating for a student and say, this student has quite a lot of speech errors. If we're allocating some weekly time for someone to work on them, I think we need to allocate it for 2 full school terms or the whole year. And this document might be helpful, because I would say that some children that can't make the sound at the easiest level, where they're working on sound in isolation, it can be between 1 and 6 weeks where all they're doing is listening and pointing and shaping and trying, especially like maybe the sound. It could be 6 weeks before they can even make the sound, and you can kind of get going on the program. And you might be sitting with a school principal or a director. Or for those of you who are on here who help someone with NDIS funding, this could be part of, we need to apply for NDIS funding, because this isn't just, it can be done in 6 weeks. And sometimes an NDIS planner might say, oh, I've got a guideline here, 10 sessions for the year, that would be enough. And it's useful to be able to say, actually, no, it could be 6 sessions just to establish the motor patterns that are needed. It says child on there, but obviously you could translate that to child or adult. So that's on there. And down the bottom, it talks about how we need to make sure they're getting it 90% plus right, or the 95 to 100, and showing how we can't rush through it. So that's a nice little document there. And then we've had this example come up a few times, and it's the L program, or L. So it's just the example program. And this is a way you could show, see, look at all the steps we'd be going through, the listening and pointing, and then making the sound, the imitating, and then going through word levels and two word phrases. So that's in there as well. And then I've just put one of those pro forma sheets there at the end. So the different types. So that's going to be in the supplementary items. And I thought that, first of all, if you print that off, look at it for yourself and go, wow, I know all this now. This now makes sense to me. So, that sense of achievement. And then go, who could I share this with? Who would this be really valuable for? So if we think about generalization, just to make sure we're clear on what that is, it's about being able to go where the dot points say, into all words that have been taught specifically. So you might have been working on some key words that are now being said clearly, or a specific sound that's being said clearly. And then we want to see the correct sound appear in words that have that target sound, but you haven't taught them. So an example is, you might have worked on shoe and sheep and shop, but you haven't specifically had a session working on show, but you know that previously the client was saying, do me that. And then they've come in and spoken to you, and not as part of the therapy, but just as chatting, and they've gone, can I show you something? And inside you're like, yes, I didn't teach show, but the sound has gone across to that word. That's a really good example of generalization. It's actually natural, isn't it? That's what happens with little children when they first learn to talk. They might say, I love you, mummy, I love you, daddy. And then we teach them, oh, look at that, it's a light. Can you say light? And they get light. And then they come up and go, I love you. And we didn't have to teach them that. It's just done it. It's generalized. The third dot point down, in all word positions. So the person that was saying dop for shop might have been saying bidding for fishing. I'm going bidding. I'm going bidding. And we're like, what is that? And then we've worked on f in the word initial position and sh in the word initial position. And now they've come up and said, I'm going fishing. But we hadn't even got to word medial position. And this is what sometimes happens. It generalizes to other word positions without us having to teach it. And that's another good reason to just work on one word position at a time, because we just start with one word position and then we're hopeful. And quite often it does transfer to other word positions with all communication partners. So sometimes we actually have to say to the client, don't forget to use your new sound when you talk to this person, or when you go home, or when you go to the party, or when you have your friend over, or when you're at school. Like, actually say that. Or have you been using that sound? If you're taking them on an outing to the shop, hey, when you go into the shop and you're going to ask for coffee, it's got f in the middle. Let's have a couple of practices out here. Coffee, coffee. Hey, when you go into the shop, I might listen out, and then you listen too. And afterwards, shall we see if you remembered to say coffee and not cobby? And so you're showing them that it's all partners. And then a few weeks later, you might be at the cafe with them and you didn't even think to prompt them. And they've gone up to the counter and they've said, can I have a coffee? And you're like, oh, I didn't even have to remind them. So you're actually still listening to see that it's worked in all locations, places, and contexts. Sort of just another way of saying that. When is the best time to work on generalization? So we can't work on it until they can make the sound and say it in words confidently, and they're at a fairly good level of accuracy. But once they can, so we've got here, once the sound production is at that 95 to 100% level in the therapy session, and they can maintain it in a sentence, then we're ready to start using generalization. Because generalization includes everyday speech, do you remember when we did topic 5 and you could imitate done for sun and lidden for listen? But if I said, say a whole sentence, the dinger is dinging a dong, and you might go, the dinger is dinging a dong, because you just couldn't think of every word. If they can't really do it in those sentences, then it's a bit much to expect them to use it in their everyday speech. But once they can, then we can start to remind them, hey, you could be doing this when you go to school or when you go to that group. There is another way we can do it. Generalization might be suitable just on single words if we use a high usage word approach. And this is where they can't do it at a sentence level yet, but they can do it on a single word, and it's a word that's appropriate to use in a single way. So there are some words that we just say one word, like bye or please. And one I use with kids, which was on the video, is off. So, what should we do to this switch? Should we put it on or off? Off. Did you see what I did there? It was a choice. So when there's choices, do you want tea or coffee? An appropriate answer is one word, coffee. So coffee could be a high usage word, and we could aim to generalize just one word. We'll look at that in a little bit more detail. The role of the team in generalization, and we're going to go through this on the further pages. And then the listening for signs of generalization. And I started to talk a little bit about that just as I was chatting then. And that's the best bit for you, when you go, wow, listen to that. It's actually really nice when you don't see someone for a little while and you see that the new sounds have generalized. So yeah, be ready to listen for that. It's amazing. This section here is talking about how we can juggle more than one thing at a time. And you might have started to work this out for yourself, but you might have one sound that you're just starting at, like they can't make so you can see that first dot point. So you're just working on that at an isolation level. Right, we're just going to spend 2 minutes and we'll have 10 practices of forming our mouth. Oh, good try. Oh, not quite. Let's try that again. You could see that that might just take 2 minutes of the session. And then you might go on to another sound. It might be the S clusters like star and spoon. And you might be doing that just say at a word level. But then you might say, do you remember a few weeks ago we were working on shh on the end of words? Well, let's go back and have a look at that. And on the video, I had the picture of the chicken and the chocolate and I think the cherries and the children. So you might say, hey, let's just take a minute. Let's get an old picture out that we used a few weeks ago and we'll just have a chat about it. And I'll just be listening and seeing if you can tell me about the picture. And you're listening to see if they can use everyday speech. So within the one session, you might be spending, say, 2 minutes on this quite hard sound. You might spend 15 minutes on the sort of main goal, and then you'll go, let's check on something that it's generalized and it's been maintained. And that can be a really efficient way of working through therapy as well. And down on this one here, you know, we've said that sometimes speech skills might regress. It's hard to not get disheartened when that happens. And that could be a really important part for your role. That could be part of what your role is. If you work with someone that's a long-term client and it's quite an effort for them, you know, you're there as the encourager and you're there for the long term. And one of your things will be just to sort of cycle through the different speech sounds and keep an eye on them and notice that sometimes sounds do regress because nobody has assisted that person for a while. And, you know, we might take some responsibility to go back and check. So just be thinking about that idea of generalization. It's like checking on things. It's sort of like maintenance, I guess, a bit, isn't it? You know, you might spend a bit of time working on something and then you go, oh, that's going okay, but it's going back and checking. So this is one of our pro formas that I made up. There we go. And if you have a look at the thing here with the pictures, you might be just making an idea of, you know, who this is going to be suited to. And I guess I'd probably say this could be an early childhood picture, or it could be one that you know that your client is going to like. Sometimes even an adult, say, that's had a stroke, they might like this picture because they can see the stoplight and they can relate to the picture. It's sort of iconic, isn't it? And they can see the pictures and they might, you know, be able to point. So I guess it's just finding what works for whoever you're with. And with these sorts of documents, it's examples. So you could type up your own one and make it work for your client and your wording. But the idea was with this is you type in there, let's just say it's going to be for a preschool. So I might be the speech pathologist and I've spoken to the parent and the parent said, my child goes to preschool 5 days a week. Could you please involve the preschool? Now I could phone them, I could email them, and those things are good. But what's good about a bit of paper is if you fill it in, if you take a copy of it, if you email it, you've sort of got evidence too of you've shared it. And also some people might go, oh yeah, and I can stick that up somewhere. And it's sort of, you know, out of sight, out of mind, you might forget. But if it's right there. So we're excited to include you in the speech therapy process. The good news is that, let's say it's Jamie, has now been given the green light to use the following word at home and at preschool, and even when going to the shop or visiting friends. Can you help us with this high usage word? So this would be where you've mastered a word and it's a high usage. So it could be the child's name. So let's say, what did we say? Jamie. Let's say Jamie was calling himself Damie. But in therapy now, he can say Jamie. He's really good at it. But as soon as he runs out the therapy room, he forgets and he goes back to calling himself Damie. But if he's prompted and reminded, he can say Jamie. So now a preschool teacher could go, oh, well, I can think of all sorts of ways to prompt throughout the day. It could be in the morning, instead of me, saying the children's name and then they stand up to go to the toilet, I could say, I'm going to point to you, tell me your name. And all the other children would say their name. And then when they got to Jamie, they'd say, and Jamie, remember your new sound. Can you tell me your name? So it's the same amount of time for that person doing the routine of getting all of the kids to stand up and go, but it's just tweaked it a bit so that now Jamie practices that one word. Do you think Jamie's more likely to soon do the switch in his head and just be able to say Jamie more automatically? A high usage word for an adult could be if you ask them if they want tea or coffee, and if they want coffee but they're in the habit of maybe saying co-e without the f in the middle, well, you might work on that in an articulation program until they can say coffee. So now it would be making sure all the workers that come, that they don't miss that opportunity. They might just go, oh yeah, do you want your tea or coffee? It's coffee, isn't it? Yeah. And the person just has to nod, and then they just put the coffee in front of them. Or they might be in the habit of letting them just point. Whereas now you're passing on the message. They can say coffee. And if you offer them 3 cups of coffee throughout the day, well, that's a chance for them to practice that. So you're communicating this idea of one word. Yeah, can you help out with this high usage word? And you write in the space here what the word is. Now, I think it's nice to put, you might hear it said with this error, because remember, you've done the course now, so you're probably going, oh yeah, if they can't say car, it's quite likely they're saying tar for car. But that wasn't really common knowledge before, was it? Now that you know, you probably hear the errors. So in this area, we can actually write what it is. For that example with coffee, you might put, they might be saying it as co-e, and we're practicing the f in the middle. And we've chosen this word because the client loves coffee, he's motivated by it. We're hoping that down the track, other words with f in the middle will automatically generalize. And then the things to do. So remember, I gave that little example about if it was Jamie, you could just write a thing there, when you're calling out names, instead, can you ask the child to say their name, and can you prompt Jamie to say his j? If it was the coffee, it might be, if you're in the habit of holding up a tea bag and the coffee jar, could you try now leaving the tea bag and the coffee jar over on the bench where you can point to them, and you could say, could you tell me if you want tea or coffee? And so maybe previously the client just reached out and they didn't have to speak. Well, now you're setting it up so that they have to. So you're just keeping that really simple. This will be in the supplementary items. You want to just take a moment just to read through that? Down the bottom, I've said, remember, just focus on this one word, because we want it to be a positive focus. We don't want them to be picking up other errors. And important, for this method to be effective, please help by ignoring other speech errors. We'll work on those at a later stage. And if you maybe pass this page to someone in the team, I'd take a moment to point that out, and I do that with the parent. Like at the end of the session, I might have been filling this out as we go, and I'll make sure I point that out. Or I might say, you've probably learned not to pick up on other errors, but who else picks him up from school? Oh, grandma gets him 2 days a week. Well, could you show this to grandma and say, can she just focus on the word off this week, and tell her not to focus on the other errors? Because, you know, once you focus on too many errors, the person can sort of switch off a bit, can't they? Because it's too much. But yeah, please feel free to make up your own little sheets. I just have made these up as examples, but you are welcome to use them. This one was the activity, so it will be in your booklet. And this is, if you like the idea of having a practice, I've started it for you. So you've gone, "Dear Margaret, we're excited to let you know that Sarah has been given the green light." The word is shoe. You might hear her say s, so she might say sue. The target sound we are practicing is. So you're just going to fill this out as part of an activity just to reinforce. So would you all agree the target sound is sh? So you'd write sh. You can be doing it now as I'm talking if you like. What's the word position? Word initial position? Yeah. Would you say word initial position on a form like this, or would you maybe put at the start of words? Yeah, you're going to use everyday language. This word has been chosen because, now you don't know why, but you could make up a reason. It could be Sarah loves her shoes, you know, or Sarah's always taking her shoes on and off, so you're going to get lots of opportunity. Or we've just bought Sarah new shoes and she keeps talking about them. So I guess you've had a reason to choose shoe. Now you don't choose shoe if she wears boots, insists on calling them boots, and the person's not going to be able to talk about shoes. You know, like it's a high usage word for Sarah, not in general. And then things to do, have a go at just writing some instructions. And the reason I've suggested that is it can be hard to be quite succinct. Some of you will end up wanting to write an essay and then you go, oh, and I have to scribble it out. Just do little dot points. Even better, go up to Margaret with this form not filled in and say, could we have a quick chat, and fill the form in with Margaret. So you're just dotting down your conversation. I think that's the most effective. But if you're not going to see Margaret, you might ring her and say, I'm going to send this form, or you might attach it to an email. Okay, so that's something you can do for practice. This is the next one that's blank, and I've put students' names. You could see that this is now just going up a little bit of a level of difficulty. And teachers are going to understand, you know, these concepts. So you could be putting the student's name, the teacher's name, and you're circling the word position. Can the student easily copy the focus sound on its own correctly? And that's important because remember, we don't want to do this if they can't copy the sound in isolation. And can they copy it, set the sound correctly in words? Yes. And we don't want to do it if they can't copy it at a word level, because a teacher's going to be frustrated if they're like, oh, okay, I've been asked to work on the f sound and for. And so they're going, great, throughout the day when I'm doing maths, I've got to remember this child and I'm going to help them. And then they say to the child, now remember, use your sound. Can you say for? If the child goes for, well, that's not helpful for anyone, is it? Because now it's not at a generalization level, it's still at a therapy level. So you would only do that if the child's easily saying for all the time in therapy with you. It's just that they forget when they're chatting really fast, or they're forgetting to do it. So that's why you have to sort of circle the yes. And then if you got to chat with the teacher and do it together, you might fill in the high usage words together. If not, you might guess. Like if it's l, you might put listen, library, lunch, look. Would you put lobster? No, because lobster's not a high usage word. But it's funny, I'll see people go, oh, this is one of those things where I've just got to think of words that start with L, and they put random words like ladder. But how is the teacher going to work on the word ladder throughout the day, you know? Unless they're working on firefighters, they're doing a project or something. Whereas lunch, well, that's going to be easy, isn't it? In the morning, let's talk about lunch orders. And now every day there'll be lunchtime. So it's those words that the person in the team is going to find a way to use. And then you might have a few ideas. Like I had one child who was 9 still saying once, and I was having trouble with the parents doing the follow-up at home because the boy wouldn't cooperate for them. And they said, can you see if the teacher will do it? So I went into the class and I modeled this. And what the teacher would do is he would, with a 9-year-old, he would stand in the doorway with his arm like this and go, open sesame. And then as each child went to go out to lunch, they had to say a word. So they'd say, can you say possum? And if they said possum, open sesame. And they just did random words for the kids, and the kids liked it. But when they got to the child with the target, it'd say, and what's your word you've got to say? And he'd go, lunch. And then he'd go, oh, the door's not opening. I think you might need your And then the child would go, lunch. Oh, great. But he wouldn't just go open sesame. He'd go, oh, it's partly opened. What was that word again? Lunch. Oh, it's opened a bit more. Could you say time for lunch? And then the child would go, time for lunch. Oh, it's worked. And every day, to let the child through, he was getting about 5 attempts, and it worked. And the sound transferred. And then I remember coming into the class and he'd always said 11 for 11. And the teacher said, I got him to count, and now he's saying 11. So the transferred to a different word just from that routine. And if the teacher forgot to do it, who do you think reminded him? All the kids. Do that thing with your arm. You know, they loved it. They were getting attention. So on the little sheet that I left, I had written that in the things to do. And nothing was working without a team. It just wasn't working. But as soon as we got the teacher involved, it started to work. So if for your activity, if you want to follow one like this, we can see it's for Michael. Final. I like watch, and watch me. And I'm looking at my watch and I'm watching you. What about catch? It could be that, you know, do you go outside into the play area and throw the ball and catch? Well, that could be one. It might be the teacher will go, do you know what, every day come over to my desk and here's a bean bag, toss it to me and say catch, and I'll catch it. And the student loves that because it's a little bit of special time, isn't it? So it's the two things. It's, can you generate the words? And then would it be easy for that team member to use it? Then you might go, well, I could use it. Or you might go, well, that's a good word, but it's not high usage. So be ready to sort of revise it. Match. Preschool, match. Let's match this. Can you match that? So you're finding the words that are really functional. Yeah. Great. And you'll probably be better at that than the other people in the team because you've spent time doing this course and thinking about it. And I find that sometimes people that haven't done the course and had time to think about it, they kind of go, oh yeah, but if you just gave them the sheet and it's not filled out, you might go back a week or two later and they haven't done it because it just felt a bit hard for them. Whereas if you do it with them or you already fill it out, they're more likely to get it done. Okay. And now can you just hit ch on the end? Because now I went approach. I didn't say approach, a team approach. I'm like approach. There's ch on the end. So you start to tune your brain in, don't you? Okay, so we'll just have a little look at this one here. So it's talking about in this one, which you can read through, that this idea of the green light. Ideally, it's the speech pathologist that gives the green light. If there isn't a speech pathologist around and it's your job, you would be going, okay, think of that speech hierarchy. Can they easily copy me? Yes. Can they say it on their own if I just give them a prompt? Yes. Are they getting it right 80, 90% of the time and it seems positive for them? Yes. Okay, I think green light, I'll tell other people in the team. But if you're going, you know, can they say it? Oh, they're probably only getting it right like 1 or 2 times out of 10 and they seem really negative about it. That's not one to give the green light to. So I think you can make your judgment there. Now we've got this idea of who might be in the team. So just listing the people and their role. If you've got your pen and you've got this printed, you could fill it out. Otherwise, you could just jot it down on a page. But can you think about someone you're currently working with? You could just pick one person or someone you want to help and just jot down the ideas of who might be in their team. And if we look at the pictures, we could see, it could be the person's GP or doctor could be part of the team. It could be a pediatrician or some other doctor. It could be school teachers. Maybe they go to a day program if they're older. It could be the support workers at the day program, the coordinators at the day program. It could be grandparents. You see the picture there with the grandparents. If there are parents and they have shared parenting, the child doesn't live with both parents, but they go to one parent and then the other. How are you going to communicate across to the other member of the team? The other parent might need a bit of problem solving. You might say, could we have a session where the other parent comes? And don't forget to ask things about, are there disability support workers? Are there babysitters? Do they go to before school care, after school care? Because if you write one of these forms and you get the parent or guardian's permission, you can make 10 copies of it and everyone gets the same information. That's the idea of it, isn't it? If they have an occupational therapist, psychologist, they might be really happy to follow that up, especially if it's to do with their name or one of those high usage words. When they go to a session, they get tea or coffee. Oh, they can say coffee now. And most people are happy to help with a speech goal. So I've put here, when we talked about this idea of responsibility, I've put the speech pathologist really does have responsibility to educate the client and the family about generalization. And I think the speech pathologist should be the leader in the team, but the speech pathologist might delegate that to someone else. But occasionally we know that the speech pathologist might not be confident to do that. They could be a new graduate, or they might have been given an overwhelming caseload size, and you've sort of picked that up. So you might go, look, could I step up and contact the other people? So don't be afraid to speak up. The speech pathologist might go, oh, that would be amazing, thank you. Sometimes speech pathologists are quite young, aren't they? I was young when I started. And if the other team members are older people, then it's possible the speech pathologist's a little bit intimidated. And I've seen this before where the team approach isn't working because there's someone on the team that's, maybe has a different communication style. And so it's kind of put in the too hard basket. And you could play a really important role there by offering to help with that. And, sometimes that's even the case of calling a meeting. These days it could be a meeting by Zoom. Ali, without giving anyone's, details, keeping confidential, just speak in a general way. Do you have team meetings about children that, need extra support?
Yeah, for sure. We do.
Yeah.
Absolutely.
And would there sometimes be, 5 or 6 people? Like, who are the different sort of team members that come in?
So it depends on the child, of course, but often, and depending on what it is. So transitioning to school, often the principal and either their kindy staff or someone, overseeing that will be a part of it, as well as us and the parent and any other support workers. So we've had huge team meetings that have like the occupational therapist and the speech therapist and like a intervention support. And then we have others that are less formal that we might instigate, that might just be us and the parent and one other professional, depending on what the goal is to get out of it.
Yeah, great. Yeah, so I think you've summarised that well, and those others of you listening, you could insert your sort of scenario or your team. So with those forms I've shown you, I've found over time it's really effective to have one practical sheet, just one page, that you can explain and hand out and talk about the one word. Because what often happens at team meetings is everyone passes out big reports and nobody leaves with an actual practical thing you can sink your teeth in. And if it's not your skill area, it's very hard to look at a report where there's maybe 10 speech errors listed and go, oh yeah, I could work on chit, word final position. People can't do that. Whereas if you've gone to the time to make that little sheet, or you've asked the speech pathologist and said, look, it's going to be a meeting, could we just pick one goal? The reason I like the high usage word approach, and I've seen it work, is that most people, if they try something and it doesn't work, they don't try again. But if they try something and it works, they go, oh, now I want to try something else. So if you've got that ready on something that you know is going to work, and at the meeting you can say, I'll just pass these out. I've got permission from the parent or guardian. I'll just quickly say what's written here. I've seen this work. Even Dad was willing to do it. And, it's been fantastic. Who would perhaps be willing to try this? And then when you're ready for another sheet, let me know. And I've found that works so well. And I remember, bumping into a mum and dad in Kmart, and the dad goes, oh, that was amazing. That one word that, you told us to do. Oh yeah, we can't shut him up now. Could we have therapy to shut him up? And I was like, oh. And this dad was just so enthusiastic. And all I'd done was the off, the light switch, because we made a game. The child would run to Dad and go, pick me up. And Dad would hold him up and let him switch the light on and off if he said the word off. And previously that child wasn't allowed to touch the switches. So the child thought it was great. It was lovely contact with the dad holding the child. And then the dad was carrying the child around, switching things on and off. And it generalized. And of course, they thought I was just amazing. And I was thinking all I did was say off. But from there, everyone got motivated. And then I remember at the team, they were all going, oh, the preschool, well, we could get all the kids lifting things on and off, and we could be going off. And like the meeting was the most animated about this one word, and all the other stuff, the occupational therapy and the transition to school, like that was just talked about in a monotone. And I went, yeah, this is really effective. Simple, but effective. So that's an example of how that can really work. Yeah. The other thing is that, we're all so busy. And if you say to someone, could you do this 4-page program? Most of us are like, oh, how am I going to fit this in? Whereas if you say, could you just say this one word with them? We're like, I could do that. And I think that's how I came up with this technique, because it is sort of my own technique rather than being taught it at university. And it's because I just kept having families that would be like, we just haven't done any practice, and I'd go, yeah, I know your life is hectic and mine is too. And I'd be thinking, how can I do it? Let's just have one word, just break it down to something simple. Yes, Liesl?
Yeah, I'm just thinking that I often used to say to my dance students that it's not about doing huge, big amounts of time slots of practice, and just even a couple of times, the little things.
Yeah.
Right? And even with Brett, if I'm practicing, I might do 5 minutes of a sound in the car. That's it, because he'll lose it just pretty quickly. And but it's just that you don't want to overdo.
Exactly.
It starts to unravel sometimes. That's what I found with dancing teaching.
Yeah.
If you overdo it, it actually starts to go really unraveled.
Yeah, you're exactly right. So if everyone in the team did one little bit when the client's in their context, it all adds up and works. But if everyone's given a 5-page report and not much detail, then like you said, it's like, oh, I've got to do all that. And I find the majority of people won't even read it. Whereas if it's a 1-page with very simple writing that maybe you even did with them there, or you've got to talk through, or it's got a couple of pictures, most people are like, oh yeah, I could look at that. And then they get the success. So you're right, it's breaking it down. And a lot of my speech therapy sessions, there's only 5 minutes out of the half an hour that's doing speech. The other 25 is getting the child and the family to like me and believe me and be willing to try it and be willing to follow up at home. And the progress is often better with the 5 quality minutes than the 30 minutes of, coming at it the wrong way. So there's nothing wrong with very brief moments if it progresses. Yeah, and I guess that's what this is saying, isn't it? So yeah, really good comment there, Liesl. Thank you. So we're going well. We're up to the part here where this was on the topic 10 video, so you could also go back and have a look at it. And this is idea of direct imitation, delayed imitation, and prompting. So one of the ways that we want to help with generalization is to get to the point where we can prompt a client, but they're not copying us anymore. And I think it was explained quite clearly on the video. So these first parts of this page, you could watch the video and go back over it. So let's go down and just have a look at the strategies here and just check that we're sort of feeling clear with them. So the first one is modeling the target sound in isolation, where we're saying, can you tell me what this is? It starts with a f. So you can imagine I'm holding the fork. We don't want to say fork and let the client just say fork, because it's just direct imitation. But we'll start off with it a bit easy. So we will let them hear the sound, but we're expecting them to then say the whole word. So there's a bit of effort coming on their part, but actually there is still some imitation there. So you might start with that, but then the next one down is model the mouth position, but don't make the sound. So, and this is something you might want to practice so that, you know, you feel like you can do it when you're with the client. Yeah, so model, the second one down was model the mouth position without making the sound. Can you all go to say an F sound for fork, but don't let any sound come out of your mouth? And can you see how I've used my finger? Can you do it now and use your finger as well? Because it's just directing them in, isn't it? Okay. You could do it with the finger spelling, couldn't you? Which we did in topic 9. You could do it by having the printed letter and pointing to the printed letter, but still doing the mouth shape. Do you think the client's mirror neurons are kicking in a little bit? Yes, a little bit, but some of the motor planning has to come from them because they're not hearing it. Then we've got reminder to use the new sound without modeling it, without any modeling. You're just using the prompt new sound. Could you tell me what this is? And remember, can you use your new sound? If you're working with an older child or an adult and you want to use more grown-up type language, you might say, you know the sound we're working on? This starts with that sound. Could you try and do that? So you can tailor it to that more mature language. Yeah. Then we've got compare it to another word with the same sound. So you might say, we had some food before, some food, and that starts with. So you're allowing some imitation there, some mirror neurons. We had some food before, starts with. This starts with that sound too. Could you tell me what it is? We've got quite a delay because I've done a fair bit of talking, but I've linked it in. Sometimes this is important because the client might not remember what sound you're working on. They might be distracted. They might think you just want to find out, is it a knife, a fork, or a spoon? Whereas what you're focusing on is the sound that it starts with. Linking it to the written letter, so you can write it in the air. You could write it on your bit of paper and show them. You could finger spell it. And I've gone further down and talked about the visual and the tactile, like the signing. Giving a verbal prompt and a visual prompt. See my mouth? Can you bite on your lip like me? That might work for the client that processes by hearing the verbal instruction. Maybe they picture it in their mind. And then linking back to past success. Do you remember how you said this yesterday? So you're trying to get the client to go into their memory. The whole thing with this and why it works with generalization is they've had to participate. If you say, can you say fork? It's direct imitation and there was no delay. Can you say fork? And they've just copied. It's like I could say other words, and if you just copy, then you don't remember them. So I'll try that. I'm going to say 3 words and you just say it after me. Ready? So here's the first word. Can you say arba?
Arba.
Good. Yeah. Can you say khamsa?
Hamsa.
Can you say sabah?
Sabah.
Okay. You're great at that. Can you see, Mikkel, would you say Ali's really good at that?
Sure.
Yeah. So let's say it's like a minute later. What was the first one, Ali? Can you just tell me what was the first one you said?
I don't know.
Oh, Liesl, you were listening. Liesl, what was the first one that Ali said? Don't know.
Yamcha. Yamcha.
Yeah. Okay. Get the point?
Hamza was in there or something.
Khamsa. Yeah. Okay. So the first one was arba, which is 4 in Arabic.
Right.
Khamsa, which is 5, and sabah, which is 7. That's why I can remember them. But the point I'm making here is that you sounded like you were just doing it. Okay. Yeah. If Mikkel was just in the room, he would have gone, oh, Ali's nailing her speech therapy. But the fact is, you can't even remember any of it because all you were doing was imitation. Okay. Yeah. All right. So now, who else would like to be volunteer?
Oh.
Liesl, great. Okay. So now what if I tried to get you to be spontaneous? So you're not going to get to imitate me now, okay? You'll do the first one, okay? We'll do khamsa, okay? Can you say this after me? Khamsa.
Khamsa.
Excellent. So the first sound is, can you say that? Excellent, really good. All right. So I want you to use that new sound when you say the whole word, and it starts like this. And it's got 2 parts. Can you say it?
Khamsa. Khamsa.
Good. Khamsa. Khamsa. Try again.
Khamsa.
That was perfect. Excellent. Okay, here's another word that starts the same. Ready? Khim. Khim. But can you say your word?
Khamsa.
Amazing. Well done. Okay, that's your new sound. Can you say the word with using your new sound? And remember, it's going to feel a bit tight in your throat. Can you say it?
Khamsa.
Excellent. Can you all see now that Liesl is forming some neural pathways because she was having to think how to do it? Ali, what was the word that Liesl said?
Hamsa.
Excellent. And now you've learned just through listening. Liesl, what was the word? Could you come on and tell us the word?
Khamsa.
Excellent. You can now say 5 in Arabic. Well done. Yeah. So that is how you need your sessions to go. But unfortunately, a lot of sessions, they just stay at the direct imitation. Okay. They never progress past that. And then we think that they're doing fine. Shall we all try it again and say the 3? Everyone say it. Arba. Can you repeat? Khamsa.
Khamsa.
Sabah.
Sabah.
Great, you're done for speech therapy today because you just nailed all those words. Yeah. So watch out for yourself where all you do is direct imitation. And some therapists, that's what they do because it's easy. And everyone thinks it's great. But then you never use those words outside of the session. But Liesl, can you say the word for me again? And it rhymes with pamza and it starts with kha. Can you say it?
Khamsa.
Yeah. Amazing. And you were able to do that. That's come from a stored place in your brain. That's come from your speech center now rather than just a parroting, rather than just a copying. So, yeah, really, really good. Okay. So hopefully that's a nice little sort of end summary of what we're looking at today. We're on our last page of Not Ready Yet for Generalization. It's sort of common sense, this last page, and it's just going through why someone might not be ready and then helping team members to understand, okay? So I would suggest that you just take some time to read that afterwards, and I'll just stop the share. But just have a think now, if someone said to you, like part of the team said, oh, I might help Sarah with her name because she's calling herself Dara and the kids can't understand her, all right? And you might say, oh, that's really great, but Sarah can't say yet. She hasn't been able to form. When she tries, she goes, Dara, and we can't praise her and say that's right. So could you just hold off on saying Sarah, okay? And then the next week when they come in, that same person in the team goes, she's still not saying Sarah. This is still just only 1 week later. Could you work on Sarah with it? Because I've been working on it. And you'll be like, oh, no. And I'll go, oh, how's that going? Yeah, she's not getting it. No. In fact, she's not even willing to come and try. You know, we're sort of locking heads over it. What do you think you're going to say? Are you going to be able to explain to that person, actually, Sarah's not ready. She's not ready yet. Yeah. She can't even imitate it in isolation. So think of the sorts of things you might say, but remember that person was maybe what you were like before you did the course, and to them, they can't sort of see all those steps. You know what I mean? So that's what that page will be about.
Oh, I was just thinking about the teams. We have a couple of different speech therapists that work with a few different kids, and it's the general consensus seems to be that it's the parents' responsibility to share programs and information across. And just is that the way that you guys kind of work, or like no, not at all?
No, that's right.
Yeah.
And I think that's what I was talking about before, about how you can have the scapegoat. And people can go, oh, the parents should be sharing it. And some parents are great and they do all their photocopies and they distribute it. But for a lot of parents, that's not in their skill set.
Yeah.
And I think the speech pathologist should be going to the parent, have you thought about telling someone? So I'll always say, it'd be great to get the preschool involved. Would you like me to be the one to ring them or to do a session out there? Or would you like to do that? So I'll find out, you know, what they would prefer and get a sense of their level of confidence. And if the parent goes, oh, no, I'd just rather keep it here. I'd just rather it be between you and me. I'll go, oh, okay. And then I'll go, right, I would like to change that person's attitude, but I respect their choice. So instead of saying, oh, no, well, now I'll just do it anyway, or I'll give up, I'll just start dropping some ideas of, oh, I wonder if they do this at preschool. You know, it might be good if they could follow this up, and I'll take time to educate them. Yeah. And then, you know, occasionally we will get a situation where we're like, we really need to get the preschool involved and the parent doesn't seem to feel that's a good idea. Either I might then say to the parent, you know, who else is involved? Do I have permission to speak to someone else? They might say, I'm happy for you to speak to the GP, or I'm happy for you to speak to the early intervention person. And then I could say to that person, look, do you ever visit the preschool? And sometimes you'll find a relationship that works. But I think the speech pathologist has the responsibility to be checking that it's happening. Because
make those pathways. Okay.
Yeah. That's my view. I also think like a preschool director, if they're trusted by the family, they could take that role. It's finding someone that the family trusts to get everyone involved. Yeah. But obviously we have to get consent. So
yeah, of course. All right. Well, thank you very much.
All right. Well, today's been really about what your responsibility might be and communicating with the other team members. How are you going to write it down for them? And try just picking one key word or just a few high usage words. Show everyone how that's successful. And then be ready to tell someone why they can't just do it in 1 week or 2 weeks, or they're not even ready to start. Obviously, you can get the speech pathologist to help you with that too. And people like Lisa and Mikkel, when you're working with Ashley, the speech pathologist, you might say, oh, I've noticed that Brett can't say this sound, but I've noticed that you're not working on that. Is that because he's not ready yet? Could you explain why he's not ready? And then you could also say, I've noticed that sound that we were working on, sometimes it's slipped back. Do you think it's generalised? how can I help with generalization? And start to use those words with the speech pathologist. Ali and Janine and Yara, if you're in the schools or the preschools and a speech pathologist comes in, how can I help this generalize? I know it's grandma that picks them up after school each time. Are you aware of that? Could we get a session where you speak to her? Think about whether a meeting would be useful or a Zoom meeting. And I guess for Keita, who's, coordinating a team, it might be, you say to Lisa and Mikkel, hey, why don't we get together and talk about what are all the opportunities for generalization that we haven't thought of? What's happening in our client's routine where we could go, oh, when he does that, there's a key word, and we could, instead of saying the word for him, we could see if he can be prompted to say it. And you'll see such improvement with that. Yeah, Lisa?
I just with this, Mikkel, you may have noticed this too, but before talking about this, I've just noticed, I think Brett is starting to generalize with his speech, and at NeuroMoves they've been trying to, because he has a lot of fear around his activities, and so to distract him they've been doing trivia type questions. And I've just noticed the other day he said he had to say 66. The answer was 66. And I actually noticed him focusing on the sound.
Wow.
And that was just happened.
Yeah.
That was nothing from me. So it was good
That's it. It's generalized. Yeah. That's
starting to generalize.
Fantastic. Yeah.
And yesterday he was with a care worker and he had to repeat what he'd asked the carer to do, but I could tell he was really taking his time to ask the question clearly. It was really it's nice to have this tutorial because I can really relate to it this week.
Yeah. No, that's excellent. And so you can observe those happenings. So you can observe, oh wow, I can see what happened and I can label it. And you can create them too. Like, let's say you've heard him say 66. You could then say, oh, let's say it was Fred sitting at the next table. Hey, could you just tell Fred what your number was? And then if he turns and goes 66, you've given him another opportunity to practice it and reinforce it. And you've given yourself an opportunity to go, yeah, that's twice now he said it right. He really has got this. And so it's really good to create little situations. Someone like Ali, you might teach a child that's been saying bore and now they've got 4. So you might say, let's go and find Miss Sue, and can you tell Miss Sue how many? And then when you get there, think, right, I'm not going to say, can you tell her 4? Because that would be direct imitation. You might go, can you tell her, and remember, bite your lip, tell Miss Sue. And so you've created the situation straight away and dropped the prompting back to a level where she can still be successful, but it's coming from her brain. So look for those opportunities. Bye, everyone. Bye.
Thank you so much.
Bye.
Bye.